In the coming years, these grounds will be a place where healing happens. In the heart of Indian country in South Minneapolis, this land will be home to the Minnan-Dewey Wellness Campus. It will combine traditional healing methods with state-of-the-art medical, dental, and specialty services in a campus setting, according to the Indian Health Board, who is behind the project.
We're over 50 years in its making, and we're the very first urban Indian health organization in the United States. And that started part of a groundswell of people coming together and recognizing really the lack of healthcare services to Indigenous people in the Twin Cities area.
Dr. Patrick Rock, CEO of the Indian Health Board, says their work is helping address some of those health disparities.
As we know that health disparities are common, unfortunately. Stuff that's commonly written about, has relatively common knowledge on things such as diabetes, heart disease that affects my community. And of course, COVID had a big impact on our local community also.
And I've done research in Indian health for a couple decades, and a lot of the common themes is that Native patients don't feel welcome where they're at, or there's different belief systems in place. And so the Indian Health Board Clinic here in Minneapolis is totally centered on cultures. There's many cultures among our Native peoples.
This campus will nearly triple their footprint, putting them at the center of it all.
Over the years, we recognize that the avenue, Franklin Avenue, has really become a central hub of where a lot of Indigenous people live and do their business and work. Putting us into the forefront and putting us right into the community was an important part of our decision making.
Today is the first time in the state of Minnesota that we're officially acknowledging Indigenous Peoples Day.
From Governor Tim Walz to U.S. Senator Tina Smith,
it's not just about one day.
Elected officials came together for the ceremony. The $24 million project was made possible thanks to funding at the state and federal level.
Equity in grant making, equity in bonding, and saying that we are going to set aside dollars specifically for Indigenous communities and specifically for communities of color who have been left out of this process for far too long. Because you know what? We know how to best invest and spend those dollars in the ways that make sense to our own communities.
With a groundbreaking set for the spring,
we ask for blessings on this earth here today.
The community came together to prepare the land to become a place where healing happens. The Indian Health Board will break ground on the site in the spring with plans to open 2 years later in the spring of 2026. Jana.